Great.
Thank you,
Well,
Emily. Take it away.
thank you so much for having me. Thank you all for spending your time here today. Like Monica mentioned, I'm a psychologist and I work with people who are going through infertility, who are going through pregnancy loss, and I work with them really throughout their reproductive journeys. So this is something that is really important for me to talk about, speak to, and I'm just really grateful that, you're all here today, and hopefully we'll walk away with some practical tools and things that you can use to help support yourself in your own journeys. I'm just going to share these slides, so just bear with me for 1 second. Um, I don't know why I always get nervous when I have to share slides since tech stuff makes me nervous. So 1 moment.
Great. Take your time.
Okay.
Yes, perfect. The full screen view should be great.
Good. Okay, great. So let's see. Just having a little trouble moving the slide for some reason. There we go. Okay. So this is just a little bit about me. I'm a psychologist, certified perinatal mental health provider. If I use the term perinatal mental health at any point today, if you don't know what that means, it's basically just mental health related to any point in a person's reproductive journey, from trying to conceive, experiencing a loss through pregnancy, postpartum, and then beyond that. I have additional training in infertility counseling, pregnancy loss, and mindfulness approaches. And mindfulness really incorporates a lot of the work that I do. So it's something that we're going to talk about a lot today as well. And as Monica mentioned, I own Phoenix Health, which is an online therapy practice that specifically we support people who are going through their own perinatal mental health journeys. So, the emotional landscape of infertility and loss, it's kind of interesting to talk to you all today because a lot of you are probably in this. So I kind of feel like this is very different when I speak to providers who don't always have that personal experience. You all are living this, so a lot of what I share is going to feel kind of obvious. But I just want to talk a little bit about how anxiety and depression are very common when you're going through infertility or following any type of a pregnancy loss. And they often manifest in very different ways. Some of them, what we would kind of expect, and then sometimes in ways that we wouldn't expect. Anxiety and depression are the most, common responses, and they're very much intertwined with grief and often overlap with each other. And in regards to anxiety, it's very common to feel that worry, that sense of tension, that sense of fear. And it often comes up with other symptoms like feeling very irritable, having trouble concentrating, difficulty sleeping, and feeling really um, physically and emotionally fatigued. Depression is more of a mood state, and that can look like sadness. It could look like an inability to feel kind of any pleasure or joy as you're moving through life. And again, that can also be accompanied by things like difficulty concentrating, changes in your eating or sleeping habits, a lack of energy, feelings of guilt or worthlessness, and in more severe cases, even thoughts of not wanting to be here anymore. The really difficult thing about infertility and loss, which again, I don't really need to tell you all, but I just want to speak to it, is that there's a lot of things about going through this journey that are unseen to the outside world. The outside world's not seeing the medical trauma. They're not seeing all the silent losses. It's more than just the actual loss, it's all the losses that accompany that loss. And it's really a form of disenfranchised grief, which is grief that we don't formally recognize by society and we don't really have words to talk about. And as a society, we feel very uncomfortable talking about it. And as a result of that, a lot of people, just simply don't talk about it because they feel uncomfortable, leaving us to feel really very much alone and feeling like we're going through this journey by ourselves. And I just want to state that this is a very normal reaction to something that's really deeply painful and abnormal. And when I say normal, meaning that you can't expect a person who's going through this to not have an emotional reaction, to not struggle with anxiety, to not feel depressed at times. Just because it's normal doesn't mean that you should have to suffer without support. But I do want to put it out there because I think often there's a lot of self-judgment when we're feeling these things, and that self-judgment really exacerbates the pain that we're already feeling. So it is very much a very understandable reaction to something that is just really difficult and horrific.
Emily, I just wanted to touch on really quick the disenfranchised grief. I hadn't heard that term um, until maybe the last 4 or 5 months when I met a woman who went through a grueling IVF process and decided to create a deck of cards, like mantras around how to like talk and just like process the grief around fertility specifically. And I thought it was so beautiful. I'd love to know from the people here, you can drop in the chats if you have heard that term disenfranchised grief. I'm just curious if I am the only one, but it actually really helped me just understand and kind of articulate like yeah it's really difficult to put into words the everything that comes with this process and journey. So thank you so much for bringing that up. Oh, and by the way, this is definitely an open discussion. If anyone has questions or wants to drop notes in the chat or reactions, like please do.
Yeah, I definitely really welcome that and appreciate any questions or comments. Want this to be really interactive. Yeah, I think disenfranchised grief, it's not a term that we really talk about too much, but it really is true that infertility and pregnancy loss specifically are two losses that we just, as a society, we don't really know how to recognize or talk about, and they're very uncomfortable for people. And I often hear from family and friends of those that are going through this that they feel like they don't know what to say or what to do. So sometimes they choose to say or do nothing, and I think sometimes that makes it a
Yeah.
lot worse. So a lot of my work is actually on and coaching people who have loved ones that are going through this on how to talk about it because that's very important.
So important. Thank you.
So our focus of this talk is really on giving you tools that you can use in the moment to regulate your own nervous system and to cope with all the emotions that can come up as you're going through your journey or whatever that might look like. So I want to touch right now on three tools that I think are really helpful. The first one being grounding. And these tools specifically are really helpful when, and we all know this feeling, like when we're in a moment and we feel so emotionally dysregulated. We feel it in our bodies, we feel it in our brains, we might feel it in all different places, but we know what that feeling feels like, where we just cannot get we feel like we have no control over what we're feeling. So that's when you want to pull out a tool like one of these because you can do them on the go, on the fly. You don't need anything. You don't need any props or anything to do them. And they work very quickly and very effectively. So one really popular grounding technique is the 5 4 3 2 1. And that basically is where you take a couple of deep breaths, you try to center yourself. And then you go through listing, you can either say it out loud or just inside your mind, 5 things in your environment that you can see, 4 things that you can feel, like feeling, say, your body, like I feel my body in the chair, I feel my hands are clammy. You go through 4 things you feel, 3 things in your environment that you can hear, 2 that you can smell, and that 1 that you can taste. And it's really helping you tune into your senses, which helps calm and ground your nervous system. And you might even want to do a couple of rounds of that or piggyback a grounding technique with a breathing exercise or a mindfulness exercise, which we'll get into as well. Breathing exercises are also very effective for when your body's in a fight or flight reaction. There's a couple different ones. So, you might have one that works really well for you. I mean, there's a ton out there. So if you have one that works for you, you should by all means pull that one out. But if you're not familiar with some of the different ones, box breathing is a breathing technique where your inhale actually matches your exhale. And when you're doing it, you kind of visualize your inhale like one side of a box or square, the exhale is the other side. And then the inhale, the second inhale is the third side. And then the final exhale is the fourth side. So you're making a box. And you can do this for about 4-second inhale, 4-second exhale, and do several rounds of that. And that visualization of picturing the box also helps kind of keep you on track. There's also the 4-7-8 breathing exercise. So that's where your inhale is going to be 4 seconds. You're going to hold for 7 seconds, and your exhale is going to be 8 seconds. I personally find this one to be the most calming. Having that exhale slightly longer than the inhale really helps activate the parasympathetic nervous system, which helps trigger your relaxed response and counteract being in fight or flight. And then alternate nostril breathing. So that's where you take two fingers, usually it's your thumb and your ring finger, and you place them alongside your nose, and each finger is going to work to close off one of your nostrils. And you'll close off one and you'll do an inhale, and then you'll switch the nostril that you're closing off and exhale. And then you'll do an inhale in that same nostril, and then you'll close it off and you exhale. So you're kind of going back and forth between closing off each alternate nostril and doing an inhale and an exhale. And actually, I find that the act of going between it takes a little coordination, and that also helps keep your mind on track to help keep it from going off to different things. So that's also a really effective breathing exercise that you can do.
I personally have done box breathing before bed, or if my mind's racing in bed, I didn't know it was called box breathing, but when I started yoga many years ago, my teacher taught me how to breathe. And so when I just am laying there and my mind is spinning, just I usually count 8 seconds in and out, and I fall asleep like right away. And it's just, yeah, it's just such a simple but powerful tool.
Yeah, it's amazing how well these things work. And sometimes, you got to kind of work at it, do several rounds, give it a little bit of time, but they are really effective at calming down that nervous system. And then the self-compassion break, this one I love. So this is where you take a hand that you place on your heart and you acknowledge your pain, that this is a moment of suffering, or I'm feeling sad right now, or I'm feeling nervous right now. And then you offer yourself that kindness, and you can say a mantra or an affirmation like, may I be kind to myself in this moment. But what I love about this is that it's recognizing your pain. We know that so many problems come from trying to stuff your pain away or from judging yourself for feeling how you're feeling. I have to say, as a psychologist, oftentimes I find it's not always the event or the thing that's happening that causes the majority of the distress. It's the judgment that the person feels for how they're feeling about what's happening. So my work with a lot of people is to help them understand, like, it's okay to feel sad. It's okay to feel hopeless. It's okay to feel angry. Like, let's make space for this feeling, because when we make space for it, we give it a little bit of time, we can work with that. But when we get upset about ourselves or we judge ourselves for feeling angry, now we're just adding kind of an extra layer of judgment and shame. And now we're just complicating our emotions. And that's a lot harder to work with. I mean, we're human, right? Like, these are, like I said before, these are normal reactions to really difficult things. And when we can give ourselves that permission to feel it and to let go of that judgment, it takes away a lot of the heaviness of what we're feeling. So this is something that just a beautiful practice that you can incorporate anytime you're having an emotion that feels difficult or feels painful or uncomfortable.
Yeah, it's so important.
Sorry, these slides are a little tricky to navigate. There we go. Okay. So now I want to shift a little bit to talking about the power of our thoughts and the fact that we have tons of thoughts, like thousands and thousands of thoughts every day, right? And some of them are helpful and some of them are very unhelpful. And being able to be an observer of our thoughts without getting sucked into them all the time. It's very much easier said than done. But I always tell people you can't always help how you feel. So again, that comes with like not beating ourselves up when we feel a difficult emotion. You can't always help how you feel, but you can work on choosing a different thought or a more helpful thought in that moment. And this isn't about being like blindly optimistic or like Pollyanna-ish. It's just about sometimes looking at what we're thinking and taking that step back and saying like, okay, is there maybe another way that I can approach this or think about it that is going to feel better for me? So thoughts are not facts. Thoughts are not you. They're not your personality. They're not who you are. They're not part of your soul. They're these neural impulses, electrical stuff going on in your brain that you don't always have a ton of control over. But we do have the power to try to work on changing some of those thoughts and choosing a more helpful thought. So some of the things that I will work on with folks is first of all, getting really in touch with what your thoughts are. Sometimes when we're in a really emotional moment, we're not even sure necessarily what we're thinking. And I see this a lot of times if I'm talking to a client and they're sharing something that was really triggering and ask, well, what were you thinking in that moment? And they struggle to even, so they're like, well, I wasn't really thinking anything, but you probably were thinking something. It's just hard to really break it down. So when you can really break down, okay, um, leading up to my egg retrieval, I was feeling really panicked. Okay, like what were the thoughts going on in your brain? What were you telling yourself? And then let's ask ourselves some questions to try to help us examine whether these thoughts are helpful or not, whether these thoughts are true or not. So I like questions like, what is sometimes we'll ask like, what is the worst case scenario that you're thinking? Okay, that's the worst case scenario. What is the likelihood of that worst case scenario happening? And that can be helpful to kind of think through, okay, like, am I maybe overinflating the likelihood that this really scary or bad thing is going to happen? I also will ask people like what would be the best case scenario or what would be the most likely case scenario? And let's just think, I'm not saying I know what's going to happen. I can't predict the future, but let's just think about different scenarios that can happen so we can take a step back and see like that there's this range of possibilities that can occur here. That's one kind of line of questioning that can help with more of those like fearful catastrophic thoughts that a lot of us experience. And just kind of asking yourself, like, how true is this thing that I'm thinking? Or how often is this true? And getting a bit curious and poking holes in some of your lines of thinking, especially if you're making assumptions about certain things that they're going to happen or assumptions maybe about other people. A lot of us do that. Like we assume we know what other people are thinking or how they're going to react or respond. So just trying to poke holes in that and get a little bit curious about that and asking yourselves like, what would be a more helpful way to think about this situation? And now for mindfulness. Mindfulness is by far one of my favorite coping skills, emotion regulation, lifestyle practices. Um, Often when I talk about mindfulness, the first thing people will say is like, "Oh, I can't do that. I can't stop my thoughts or I can't empty my mind." A lot of us were anxious or very type A or busy. The thought of slowing down and having a more mindful experience feels really impossible or maybe even scary. What I always like to say is that mindfulness is not about getting rid of all your thoughts or emptying your mind. It's really about creating a space between you and your thoughts and being able to take that step back and observe them rather than be in them, like in that spiral. The mindfulness is noticing the present moment without judgment. And it can look like so many different things. It can look like breathing mindfully for a couple minutes, doing the box breathing or the 4-7-8, and using your breath or the sound of your breath as your focal point. It can also look like doing a 10-minute YouTube guided meditation. That could be a great way, especially guided meditations can be a great way if you're new to mindfulness to start practicing it. Or it could be taking a walk outside and just really taking in what you're seeing, the act of walking, observing nature, really anything can be turned into a mindful experience. I think sometimes the guided approaches are a bit easier if you're new to mindfulness because it's going to orient you a bit more, but anything could be turned into a mindful experience. And another thing that always tell people as well is that as you're practicing mindfulness, you are going to have thoughts come up. Your mind is going to want to go wild, and that's completely okay. It doesn't mean that you're doing it wrong. All you want to do is notice that that's happening, catch it, and then bring yourself back to the mindful practice. And your mind, your brain will keep going back to more thoughts. It's just the nature of the mind. It's going to keep happening. And all you have to do, your only job is to catch it and to bring it back. And if that happens like 100 times in 5 minutes, that's completely fine. You're still doing mindfulness. What you're doing is you're getting better at that catch and bring yourself back process. And the more you do it, the more effective you're going to get at it. And then, outside of your mindfulness practice, you're going to then get better. It's going to translate to that, where you're going to get better at being able to catch yourself back from, a negative thought spiral or something along those lines. So it's almost like training, like going to the gym for your brain, to get it warmed up and ready so that when you're out there in the real world, you can bring yourself back and stop those thought spirals from happening.
Emily, one of the first sessions we did was with a mindfulness teacher around mindful grieving that I thought was so powerful. Um, and it kind of led me down this path of just practicing mindfulness and trying to incorporate it into my day to day because sometimes it just feels so like broad or obscure. Like, am I being mindful? And I did start reading the book Untethered Soul. I don't know if anyone has read it, or do you know that one? Um, I am a huge fan of it. I'd love to hear if anyone here has read it, drop it in the chat. But I definitely recommend it as one to kind of be like a guidebook for how to separate ourselves from our thoughts and try to find that calm and ease when there's just a lot. There's so much that we're dealing with life, with our fertility journeys, and it truly is, it is a practice, and it's been really game changing for me.
Yeah, that's a great book. I think for me, one of the biggest takeaways was how he talks about letting things let them go through you and let them go instead of holding on to them.
Yeah.
So much of our tension and our stress comes from holding on to things not going the way that we want them to, or predictably.
Yep.
And I think he does a
It's
really nice
easier said than done, but it's possible. It's like,
job.
it does take work.
Exactly.
Yeah.
Yeah. I was hoping, do we have time for like a 5-minute
Yeah.
mindfulness practice right
Yeah.
now?
I think that would be great.
Wonderful. So I'm just going to guide us through 5 minutes. So if you've never done this before, all you need to do is either be sitting or lying down. I think a lot of you have your camera off so you can get comfortable, lie down, have a blanket over you, pillow. And ideally, you're in a quiet space. And I'm just going to talk us through. And as I'm going through, again, your minds will probably wander, and that's completely okay. Just try to catch it when it does, and just try to bring yourself back to my voice and the things that I'm saying. So find a relaxed and comfortable position, either keeping your back upright but not stiff, and allowing your hands to rest wherever is comfortable on your legs or in your lap, or lying on your back with your arms by your sides. And then allow your eyes to gently close if that feels comfortable, or allow them to be open with a soft but relaxed gaze. Taking a moment to invite your mouth to be relaxed, your teeth to slightly drift apart, and your lips to lightly touch one another. And your tongue can rest wherever it's comfortable. Now invite your attention to really become internally aware. This internal orientation, feeling your body and noticing your body from the inside, inviting a sense of relaxation and also a bit of curiosity and interest. Now try to notice different qualities of your body. Notice the steadiness of your posture. Be aware of all the contact points of your body, the connection points between your body and the chair or the floor, and even where your hands are resting on your legs or in your lap. You might even notice and feel the sense of gravity that gently pulls you towards the ground. As much as you can, try to hold all of this with a sense of ease and relaxation. And now invite your attention to tune into the natural flow of your breath, and see if you can notice the felt sense of your breath wherever it is felt most easily and naturally. This could be in your belly or in your chest, or it might be noticing your breath at your nostrils. And allowing the breath to be natural, not controlling, nothing you need to do to it. You're tuning into the rhythm of the in and the out breath, moment to moment. Now you might notice that at times your attention wanders, might drift away from your breath and your body, and it might get caught in thinking, planning, or worrying. This is completely normal, and it's not a problem. Your attention will drift, and at some point, you'll notice that it's drifted. And this is when you get to practice kindness and patience. So, reconnecting your attention with your breath and your body. No need to yank the attention back, holding it with a real sense of gentleness and patience. So, now let's practice in silence for a few moments, remembering that there's nowhere to go. And each time the attention drifts, simply return with kindness and gentleness. Now, let's end by taking a few moments to appreciate that you've taken this time to intentionally become embodied, creating a pause and a break from the constant doing and returning to a sense of being with your body and your breath. So, remembering that you can practice this throughout your day as needed. And when you feel ready, you can open your eyes and bring your attention back to the room.
Thank you, Emily.
Thank you. That's just kind of a little taste for what it can look like. And this is something you don't need a lot of time to do. You can do 5 minutes a day, even 2 minutes a day. It doesn't have to be, anything crazy. Um, the most important thing is just to practice that non-judgment and practice that self-kindness. And when your mind wanders, just bring yourself back. And I promise you, it does get easier the more that you do it.
Does. Yes.
It definitely does. Okay, so reconnecting with yourself amidst grief. Infertility and loss can make you feel really disconnected from yourself. You might feel like you don't know who you are. You may feel like your identity has shifted. These are all really common experiences. And a big part of healing involves rediscovering yourself in the context of what you're going through. Honoring your story, when you go through loss, when you go through infertility, it's you have this story that you're living in your life, and the story feels like it's gone off on a different path. It took a turn somewhere. It was an unexpected turn that you didn't predict, you didn't want. And figuring out what that how to understand that story with this unexpected turn is really challenging, but that is part of the healing process, is like making sense of all that's happened, creating space for all the feelings that you have about this story, and finding ways to reconnect with who you are. And I think that can look really different for different people. For some people, journaling or creativity can really be a way to reconnect with yourself, get back in touch with yourself and those feelings. For other people, it might be through their body, through physical activity like yoga. It could be through nature. I think we all have different ways that we do that. So things that might have worked for you in the past, or trying new things, I would recommend as a way to try to find that recognition again. And creating that support map. So support is multifaceted. There's internal supports, and those internal supports are that's you, that's your inner strength. So I like to ask yourself, what are your greatest strengths? And how can you lean into those? Like that compassion, self compassion, resilience, determination. Those are things that you can lean on as part of your support map. And then we have our external supports, our safe people, the people who we know we can go to and they either understand it, maybe they've been through it, lived through it, or maybe they haven't, but they are very compassionate and empathic, and they give us that space. Naming like 1 to 3 people that provide that sense of safety and support for you. And our support map can also look like professional support. It could be our doctor, therapist, our yoga teacher. It could be a small team, a large team, but leaning into those professional supports of people who can be there for you. And then where is your soft space to land? What is one activity or place that brings you comfort no matter what?
I'd love to hear if people have that place. Please drop it in the chat. Let us know. For me, I talk about this a lot. I love going to concerts. For me, it's like a energy like release. And I love the energy of like being around a lot of people, and I miss that a lot in COVID. And so um I recognized when there were no concerts and people weren't gathering how much I needed that. And so my husband and I try to make it a point to go to a concert at least once every couple months. And yeah, it's my thing.
That's amazing. I think for me, it's mindfulness. I always know if I can, even if I'm having a tough day where I'm having trouble relaxing the brain, give me 20 minutes and I can get myself there.
That's
And
incredible.
it's
Yeah. We have some great comments. Bar studio, the ballpark, singing, yes. So important to never kind of lose those places and activities that are so important and special to us.
and sometimes we don't want to do them when we're not feeling good,
Yeah,
even though it's the time that we need it the most.
yeah,
But having that place in your back pocket, okay, if I know if I let myself do this thing or go there, I am going to feel better or more connected to myself, or it's not going to take away everything I'm feeling. I might have some of these thoughts and these feelings, but it's going to do something for me that's going to be positive. So I'm
yeah,
pushing yourself to do it.
absolutely. Oh, great. Yeah. So that takes us to the end. I do actually, before we get into Q&A, do you want to talk a little bit about Phoenix Health? I did add that last slide. That I think it would be a great place just to share a little bit more about your company.
Yeah, I'd love to. So, Phoenix Health we're a multi-state therapy practice. We're online and we offer care in 42 states. We do take insurance in three of those states, New York, California, and South Carolina, but we're working on also taking insurance in those other states as well. Our care, what makes us special, I like to say, is that we're specialized. So, myself and all the therapists on our team are all licensed mental health professionals, and we all have experience and training in working with perinatal mental health and infertility and loss. We provide evidence based care. So these are therapeutic approaches and techniques that have been shown in research to be effective for helping people going through perinatal mental health concerns. And our mission is really to make the care affordable and accessible. The accessible piece comes in through the telehealth. I think it's important to be able to meet people where they're at. I know when I was going through my own perinatal mental health journey, it was very hard for me to find a therapist, even though I was a mental health professional myself. And this was pre COVID when telehealth wasn't an option. The thought of getting to an appointment was such a barrier for me. So, having that accessibility that you can log in and have a session online at your convenience, and then the affordability. So that's where we take insurance, and we're working also to get on more insurance networks because unfortunately I hear often that the cost of mental health care is a barrier for a lot of people, which breaks my heart. So that's a little bit about us, and um, can find us online. Our website is joinphoenixhealth.com.
Awesome. Thanks, Emily. And Emily's profile and links to Phoenix are in the resources section in the Rhea platform. Great. Thank you so much. This was really incredible. Thank you for the very practical tools. I wanted to open up the Q&A session with something that a lot of our members said they wanted to hear about, and that was really understanding the different type of therapy options that are available. Can you actually start with EMDR? One of our members mentioned that it was actually the thing after many years that helped her process a lot of the trauma that she has through her fertility journey. And then any other of the main ones, somatic, CBT. Would love to kind of dive into those or do a quick overview of each, I should say.
Absolutely. So there are a lot of different approaches to therapy. EMDR stands for eye movement desensitization. I always struggle with that word, and reprocessing. And it's a type of therapy that's specifically for people who have gone through traumatic experiences. And it uses bilateral eye movements that are done while you're processing the trauma verbally. And the idea is that as you're processing the trauma, you are reintegrating it and thus creating more relief. So you're able to process the trauma and figure out kind of how to move through life post trauma. Some other common approaches are cognitive behavioral therapy is probably one of the most popular or widely used types of therapy, CBT for short. And that type of therapy really looks at the relationship between our thoughts, our feelings, and our behaviors. And a CBT therapist will go in and they will help you identify what those helpful versus unhelpful thoughts are, and then work on changing the unhelpful ones to more helpful alternatives. And they'll also really focus on equipping you with skills that you can use, in the moment to regulate yourself, cope. Somatic therapies really focus on the mind body connection. So the idea is that stress and trauma gets stored in the body. So that might look like incorporating mindfulness approaches, incorporating yoga, body, things that kind of move the body and then release that stored stress and trauma. Psychodynamic therapy kind of goes with like interpersonal and relational therapies. Those focus more on your relationships and specifically your relationship with a therapist. So the idea is that your relationship with your therapist is kind of a model for how you've related to other people throughout your life or even early childhood caregivers. And through kind of understanding that relationship, it helps you better understand early childhood experiences, brings up some subconscious um, memories or things that you've been through, and then that insight is supposed to help you be able to kind of move forward. Um, Other common ones, acceptance and commitment therapy is another one that's gained more popularity. That really, or ACT for short, that really focuses on accepting your thoughts and feelings as they are. And then there's a strong emphasis on your values and living life in line with what your values are. I would say those are some of the more common ones, but if anyone has questions about any other approaches specifically, I'm happy to answer them.
Okay, awesome. That was super helpful. And before I open it up, I just one other question that was just high up on the list among members was really just, obviously Phoenix Health exists, but for someone who is wanting to um, seek therapy or maybe has tried working with a few therapists and it just hadn't worked out, what advice do you have to really just finding what is right for you?
Yeah. So kind of a two-part question, like finding a therapist and then also finding the right.
Yeah.
Okay.
Or
Yeah.
just, the right, um, kind of the right mix of mental health support in general. Like, obviously, these day-to-day tools and practices that you've given us are so powerful. So that's a part of it. But when you want to go deeper,
Mhm.
um, yeah, what advice do you have?
Yeah, in terms of actually finding a therapist, some of the common routes are contacting your insurance company and asking for a list of in-network providers. Another way that you can approach it is asking one of your healthcare providers, your doctor, your OB, your psychiatrist for a referral or recommendation that they have. You can also kind of poke around online. Psychology Today is probably the most popular directory that they have out there, and it allows you to narrow down your search. So you can search by what insurance you have, what type of therapeutic approach you're looking for, your specific condition. And they do have boxes for infertility. They have a box for, they put pregnancy and postpartum together. They have one for women's issues, and then they have grief and loss. So if you kind of check off all those boxes, there's a good chance the list is going to include a provider that encompasses that whole spectrum and likely has training in working with pregnancy loss and infertility. Postpartum Support International is an organization that also has a directory, and all the providers on their directory are certified in perinatal mental health. So you can guarantee if you find a provider on there, they've all been vetted, they have that training, and their website is postpartum.net. So those are some ways that just to find the therapist, but then finding the right therapist, I know that's something that gives a lot of us anxiety and concern. I think it's helpful to kind of go in with any questions that you might have so that when you're reaching out to a provider, either by email or over the phone, you can ask them anything that's important to you to know. Like if you're curious, how do you work with clients? What is your approach? Um, how do you handle a first session? You can, if you're new to therapy, let them know that. Anything that is helpful for you to know, don't feel shy about asking. We're happy to answer questions. And sometimes it just does take a little bit of time to feel out, if it's the right fit or not. But our job as therapists is to also be open to how therapy is going for you. So we invite you to share if you're having feelings about how it's going, you're not finding it helpful, we would much rather know. And hopefully, we're asking you. I always try to ask in the first session and then periodically as therapy is going on, like how people feel like it's going, and if there's anything that they like or they don't like, or any ways we can improve the experience. But if they're not asking, just don't be shy about telling them because we're trained to be able to have those open and honest conversations.
Okay, awesome. Yeah, and I really um think it's great that you offer that initial consultation just to talk to someone who has questions versus like your first therapy session being something that, you're paying for, but you don't really know what you're getting into sometimes necessarily, and you're just starting to learn, and that's the opportunity that you have to ask questions. So I think that's really great that you offer that. Great. I would love to open it up to anyone who has questions. Feel free to go off mute or you can drop them in the chat too. And I see a couple people talking about EMDR and having great experience with that. Lenny doing it this summer. That's great. Yeah, I've heard great things. I have not done it myself, but it's been coming up quite a bit. I will give everyone just a couple more seconds if they want to drop a question in the chat or go off mute. And if not, we can call it a day and give people some of their time back. But this was really, really great. Maggie has a question. Any guidance on how to deal with anxiety after dealing with recurrent loss, specifically for future pregnancies?
Yeah. Well, first of all, I think your anxiety is very valid and kind of goes back to saying like this is a normal reaction to something that's really difficult. Um, a lot of the tools that we talked about today are tailored to help with anxiety following recurrent loss. Um, it can be very challenging, especially if you're, trying to get pregnant again or you are pregnant. That anxiety often gets really exacerbated during that time. And a lot of these tools are really helpful. And I think really like having someone that you can walk through that process with, whether that's a therapist or whether that's a peer who's been through it, or your partner, or anyone in your life who's that safe person, because you're going to have a lot of thoughts that are really scary and really based in fear and worry. And when we keep those thoughts to ourselves, often that's where our brain really spirals and we lose a bit of objectivity. It's hard for us to really like look at, okay, I might be amplifying this, or I might be catastrophizing this. But when we speak it out loud and we share it with another person, when it's a trusted person who's empathic, they can kind of help us see, like, okay, this is valid, but let's also think about this. And it's very hard, I think, to do it that yourself when you're going through that. Whereas, like, that other person can be almost like that voice of reason to your anxiety and then help you see, maybe think about it in a different way, or help you pull out some of those more helpful thoughts. And that could be also found in a support group. Yeah, a peer, a support group, therapist, a partner. Sometimes the people in our life need a little training too on how to help us or how to talk to us. So it could be helpful
Yeah.
for them to have resources on how to support us as we're going through it too.
Yeah, that's another question that came in. Thoughts on what to do when people give you the generic responses around trying to conceive on having faith, or it will come when you least expect it. It's not always the best response I want to hear for something dealing with infertility, for someone dealing with infertility. Um, I have some thoughts, but Emily, do you around kind of just when loved ones are saying things that aren't necessarily super supportive or helpful, I guess.
It's really hard. Yeah, because it brings up, I mean, it can bring up frustration, anger, make you feel even more isolated. And it's just so hard because we can't control other people and the things that they say and that they do. Especially if they're people that we're close to and we want to continue to have a relationship with. Um, I think it depends on the situation, but if it if it feels right to kind of educate that person a bit, or let them know that I'm sure you mean well, but this just isn't really helpful to hear that. And like, this is how kind of I need you to show up for me, or I just need you to listen. Um, a lot of times people feel like they need to do something or they need to say something, even if it's not always the most helpful thing, but they don't always realize that sometimes listening is doing something. So if it feels appropriate and right and that person would be receptive and you can provide them, some education on what you need personally, I think that can be really helpful. And just giving yourself space for that feeling that it brings up for you. I mean, if it makes you feel angry, if it makes you feel sad, that's completely valid, and not judging yourself for feeling that way. And that self-compassion exercise by Kristen Neff would work beautifully here too, of being able to say, like, I'm having this moment, I'm feeling this feeling, I'm going to have compassion for myself, and um, you
Yeah.
know, and now I can choose what the next thought is, or how I move forward from here, or how I deal with this person.
Yeah, absolutely. I echo that sometimes when it's maybe just a acquaintance or someone that is not close to you or in your life often, it's just hard, you kind of just let it go or brush it off or whatnot. But when it is someone who you care about and cares about you, it goes a long way to tell them what you need. Um, there was someone in our community who really needed some support, just talking to loved ones who wanted to be supportive, but then also, checking in, like, how's it going? Like, especially going through IVF, and that they know there's like steps involved and checking in on all those things. And so taking a pause and taking the time to put those boundaries up, right? Like saying that I'm so happy that you're here to support me, so grateful, but we would like to, keep you updated as things come along, and just if you could help respect our space to try to keep our calm, right? Um, and just choosing the words, right, that feel good for you to put those boundaries in place is really important. And Jody said she did have that conversation with a close friend and that she appreciated that she told her that things she was saying that were meant to be comforting or encouraging were doing the opposite. And that's great. I think part of this is also, unfortunately, our job to help others understand and be better support for us. Great. Thank you so much. We're at the hour. So I wanted to thank everyone for participating. Emily, thank you for your time. I'll be posting the recording in our resources section as well. Have a beautiful rest of your day and rest of your week. Bye,
Thank you.
everyone.
Bye-bye.